If the back pain treatment isn't working and you cannot get in to see the doctor, one of these 4 tips might be what you need to find some temporary relief while you continue looking for the right office that can resolve your back pain without drugs or surgery. Hi, I'm Dr. Roy Picard DC, and I've been in practice for 35 years. I've spent hundreds of postgraduate hours studying functional endocrinology, nutrition, and soft tissue joint stabilization techniques. Myself, along with the medical doctor and nurse practitioners here at Michigan Integrative Health, specialize in helping those with chronic joint pain of the back, knee, hip, and shoulder. I'm going to demonstrate 4 things that you can try in order to give you some kind of temporary relief of your low back when you've been diagnosed with a bulging disc, herniated disc, foraminal stenosis, canal stenosis, degenerative joint disease, degenerative disc disease, arthritis, failed back surgery syndrome, or bone on bone. Now, of course, at any point in time you are concerned that this could make your back pain worse, then you obviously shouldn't attempt to do this. So the first one I want to explain is where you are going to be laying on your back with your feet elevated. Your hips are bent at 90 degrees and your knees are bent at 90 degrees. Your calves need a firm support. The first thing that many people decide to try is to go ahead and lay on the floor and rest their calves on a couch or a chair. Yes, that can be done. However, I do want you to think about one important thing. How are you going to get up? So another opportunity is to try to do this on perhaps a couch or a bed. If you saw one of my other videos on how to get in and out of the bed, that might make this so much easier for you. But what I want you to do is this. Let's say you have a clothes hamper and possibly even some pillows or cushions so that once you are on your back, your hips are at 90 degrees and now you are resting your legs over the clothes hamper and your knees are bent at 90 degrees. Take a few deep breaths. Relax as much as you can and see if you can feel some of the pressure on your back start to reduce. The next tip I'm going to share with you is pretty simple, at least regarding the setup. You may want to have a sturdy chair next to the bed in case you need a little extra support. And what you can do is go over to your bed, dig your elbows into the mattress. Your stomach should be on the mattress and your knees should be bent so that there should be very little to no body weight on your knees. You may need to strip the bed down in order to get, let's say, a little bit more traction on the mattress with your elbows, as opposed to trying to, do this on top of a comforter or sheets where it's going to be a little bit more slippery, okay? This will take a little time to get the exact positioning necessary, but once you find it, it can help you take the pressure off of your back. And as long as you're not hurting yourself, experiment with how much your stomach and pelvis should be on that mattress, and you'll find a spot that's very comfortable. The next one you can try is to go up to a counter in your house that is very sturdy, or you can go to your kitchen sink. But if you're using your sink, make sure that the sink area is dry. Put your palms on the top edge of the sink and your fingers against the inside of the sink so that you've got a pretty firm grip. Allow yourself to lean back slightly with a little bend in your knees in order to stretch your lower back. Now this should be a gentle, easy stretch where you can basically feel, the different intensity and the level of stretch in your back is going to be related to how much bend you have in your knees. At no point in time should you be doing any of these stretches where you're pulling hard or bouncing up and down in order to pop or crack your back. You're looking for a mild, relaxing stretch. And the last one for you to consider is more of a way for you to basically initially test to see if you would benefit from this. And it's very, very simple. If you happen to have a nearby playground, find some type of a monkey bar. Sorry, not that type of monkey bar, but some type of structure that the kids climb on and, they hang on to it, and something that you can easily reach. Hold the bar firmly. Let your knees bend and take about maybe 20 to 30% of the weight off your feet and hold onto the bar tight. See if you can get some stretching or some pressure decrease from your lower back. And if you're comfortable, you can even try to increase the amount of weight that you're supporting with your hands by reducing the amount of work your legs are doing to hold you upright. Now, if you notice that this is helping you to reduce pressure on your back and you're getting some relief, then you may want to consider going to like Home Depot or Lowe's. And you can purchase a kit for a chin-up bar that you could put right in the door jamb inside your house. And having it there is going to make things much more convenient, especially in the winter or if it's raining outside. Now, these tips I have shared with you are not meant as a cure. This is not meant as a substitute for medical care. These are things that I've shared with many people through the years who were suffering with low back pain when it was not possible for them, let's say, to get to the doctor's office, or they just were having a hard time finding the right doctor to help them. This is obviously not going to cure your low back pain. It's just basically a means for you to get some kind of relief. Doing this is not going to allow you to do something crazy. It's not going to address the cause of any systemic inflammation, joint instability, or it's not going to address any tissue damage that requires specific products used to repair, which are basically the different services that we offer here at Michigan Integrative Health. For more tips on how to better cope with chronic pain, as well as specific information on the different types of services and options you have other than drugs, therapy, chiropractic adjustments, and surgery for your chronic pain in your back, knee, hip, and shoulder, be sure to give us a call at 586-726-9860 or check us out at our website at www.michiganih.com.